आयज आमी बेळगांवच्या फामाद अरिहंत हॉस्पिटला भितर आसात. अरिहंत हॉस्पिटल म्हळ्यार फामाद हार्ट स्पेशलिस्ट दोतोर MD दिक्षीत हांणी एक सुरू केल्लो हो उपक्रम आसा. गोंयकार आनी दोतोर दिक्षीत हांचे नातें कितें नवें ना. हर एक गोंयकाराचे काळीज सुरक्षीत दवरपाची जबाबदारी दोतोर दिक्षीत हांणी घेतलेली आसा. Dr. Dixit is aware of what's happening with the hearts of most of the Goans who have shown their faith and confidence in Dr. Dixit. So, Dr. Dixit will be speaking about the latest developments that Arihant Hospital has incorporated in Arihant Hospital. He will also he will also appeal Goans how to take care of their hearts. So, over to Dr. MD Dixit. Sir.
Good morning. Good morning to all the viewers and all my friends from Goa. As you said, heart disease is increasing in numbers all over the world. Especially so in our country, the heart disease not only is increasing in number, but it is also affecting people who are of younger age group. We hear so many instances of news where young people at the age of 30, 35, they had sudden cardiac arrest and they have died. All these diseases, they point to only one thing, is our unhealthy lifestyle. We have no control on eating, we have no control on physical exercises, we have no control on our sleep. All these things are necessary for human body to grow. And when we compromise with these, it affects our body. Not only our body, it affects our mental health, it affects our physical health, but more important, it affects our cardiac health. Diabetes is on increase, hypertension is on increase, obesity is on increase, and all these are related to lack of exercise, food to eat. Now, hardly you find anyone who doesn't have enough to eat. So the problem is of plenty now. Earlier there used to be problem of scarcity, but now it's of plenty. So my only request to all of you is that have moderate eating. If possible, only 2 meals a day, or make me maximum 3 meals a day. No more sweet products, no more bakery products. And exercise at least 1 hour every day. Sleep for 6 to 8 hours, which is very important for recovering of our health. And if you do these simple things, then you will have a long life. But if you compromise with this, the body will respond in a negative way. So please take care of yourself. I would be happy on the day when you don't need me. So everyone should be in good health and good spirit. And it is in our hand. A healthy mind in a healthy body should be our motto. So, especially Goans, I see a lot of people from Goans who have these issues. And one of the issue with Goan people I see is that they don't go for a walk. They avoid going for a walk. They give all reasons. Today it is raining, today is sunshine, cloudy. So there should be a discipline in walking every day. So take care and good luck to all of you. Wish you best of luck. We treat here a lot of Goan patients in Arihant Hospital. I come once a month to Goa to see these patients whom we have operated. And any person who wants our help, you are welcome here. Don't worry about money and other thing. We are here for a cause here, and we will definitely try to help you people.
Arihant Hospital is certainly serving more for a cause rather than money. That's what Dr. M.D. Dixit said right now. Sir, I would like to ask you one more question. Like, there is a rising mobile addiction, wherein, people are carrying the mobile in their pockets. That is normally on the left hand side, and also, they're so addicted and all that. Is it also having affecting the people in their hearts or any other diseases?
See, mobile gives rise to radio frequencies, radio microwaves or frequencies, and it can interfere with heartbeats and other thing, especially with pacemaker and other things. So, as much as possible, avoid keeping the mobile very close to your heart and also to the brain. People who use too much of mobile, which is close to the ear when they talk, at that time they have found out that their brain waves, it affects the brain waves. More important than anything else is the mobile causes a lot of distraction, and this distraction has led to what is called as attention deficiency. So today people are very distracted. Even the average focus time today is about 8 seconds. So people cannot concentrate more than 8 seconds. So that is what is happening. So as much as possible, try to avoid using mobile. Only mobiles are used only for hearing. The second thing is, if you use mobile in the night time before sleeping, the blue light interferes with your brain waves, and it tells the brain that it's a daylight, and that's why people don't get sleep. So before sleeping, if you are able to avoid blue lights in the form of seeing phones or television or anything like that, at least 2 hours before sleep, then only you will get good sleep. Otherwise, majority of the people complain, we don't get sleep. And one of the common reason is the blue lights which emits from the phone or from any of these gadgets. It interferes with the sleep. So avoid using that.
Definitely, it is an alarming call when it comes to the mobile. We are so addicted to the mobile that forget about using it for our formal uses and all that. We are so addicted that even in the night time, people get up and try to see the mobile. But sir has advised, avoid using mobile. That is causing a lot of health issues, including your heart issues and all that. So mobile should be kept away. So another question I would like to ask: when we take around, when we take a round in this hospital, Arihant Hospital, we see a lot of patients coming from, as far as Pune and then Hyderabad and other places. Okay, one of the reasons is, yes, that you are known to be one of the best experts in this particular health issue, health matter. But what are the other things that the people are, flocking to Arihant Hospital for their heart and other ailments? Can you please speak about it, sir?
See, I have been around in this place for the last 25 years to 30 years. So most of them, we know most of the people. When we started this hospital, our aim was that everyone who can afford, who cannot afford, should be given treatment properly. Money should not deny somebody any treatment. So we have been on that motto, and luckily we have been able to fulfill that promise till now. Cardiac surgery is a very specialized way of branch where we require high teamwork and other things. So we have been able to build a big team, and probably that is the reason why most of the people are coming here, because of our team. And all my colleagues are all experts who are working with me here. We do almost about 5 to 6 open hearts every day nowadays. And still the waiting list is increasing. The only thing is that we should be able to, I cannot tell you why they are coming to me, but I am happy that they are coming to me and I have the opportunity to serve them. So I am grateful to the Almighty and to the people who have a lot of trust in me, and I try to live up to that. Thank you, sir.
So, lots of people from different parts, not only from Belagavi district, but also from extreme borders like Maharashtra, Telangana, and northern Karnataka, are coming to Arihant Hospital, especially to take a consultation and treatment from Dr. M.D. Dixit, who has been serving along with his colleagues And now the hospital has not only limited itself to the heart specialties, heart ailments, but it is coming up, and it is well known now as a super health specialty hospital. So Arihant Hospital definitely has answer to all your health issues. That's what Dr. MD Dixit has told us. Arihant Hospital is known as one of the fastest emerging hospitals in Belgavi, North Karnataka and South Maharashtra region. If you look at the rush of the patients over here for apart from the heart ailments, there are different ailments for which the patients are coming from all along the southern Maharashtra, Goa and northern Karnataka region. So we have to we need to have more details, more information about the hospital and the specialties about it. We have with us Dr. Nikhil Dixit, a generation next of Dr. M.D. Dixit, the noted cardiologist. And Dr. Nikhil himself is also following his father's footsteps, and has been gradually made inroads in the medical field of Belgaum. And by now he has already become famous for the newest and the latest procedure called as minimal invasive surgeries. So doctor will speak to us about this new procedure that is helping the patients a lot. Yeah.
Thank you for that introduction. So basically, minimal invasive surgery is nothing but surgery done with a very minimal scar. So we do it for CABG patients, or we do it for valve cases, and sometimes in the patients with ASDs or VSD, which are pediatric things. So we do that. So the basic thing about this is that the patient can go home early, and it's cost effective, and patient has minimal scar, so they have less pain. So that is the advantage of minimal access, and we have started doing minimal access in Arihant Hospital, and we have been routinely doing minimal access CABGs with very good results.
Is it by choice the patient has to go for this particular surgery, or you recommend the patient to go for this type of surgery?
So there are a subset of patients which can undergo these surgeries. It basically depends on the patient, how is the patient built, any other added risk factors, and how much extensive is the disease, whether the disease has diffuse disease. All those things are taken into consideration, but there is a large subset of patients who can undergo these surgeries.
Tell me also about the cost effectiveness of this particular surgery, and also like the kinds of surgeries that are performed under this procedure.
Okay, so first and foremost, the most common which we do is a minimal access CABGs, that is the routine bypass surgery. So instead of a big scar here, there is a small scar there. It's a very small scar, about 4 centimeters, and the patient is discharged within 2 days, 3 days. The next surgery which comes is minimal access valve surgeries, which we do. Mitral valves most commonly is done minimal access, and then there is aortic valve also which we do. There again the patient can be discharged on 2nd or 3rd day. And then we come to some adult pediatric, which is called as ASDs. When the patient is grown like 40-50-year-old, we can do a minimal access surgery in them also with a very minimal scar. Again, 2nd or 3rd day the patient goes home.
How many, what are the number of cases so far? Any number of cases can you tell us the hospital has done under this procedure?
No, so we have done a lot of cases. Like weekly, at least we do 2 to 3 minimal access cases, minimal access CABGs. So at least we do that. So we are doing good number.
So patients are opting out for this particular surgery?
Yeah, patients are. There are a lot of patients who want these surgeries because they want to join work quickly, and they want less of the pain, because the pain after heart surgery is much more. So people are now also with Google, people are doing a lot of research before coming to our hospital. So they know about all these things.
Yeah.
So yeah.
So, thank you so much. Thank you, Dr. Nikhil.
Thank you so much.
This is Dr. Santosh Hukkar here. I am a consultant cardiac surgeon at the Arihant Hospital. I have been trained especially in adult cardiac surgery for last 10 to 12 years, and we have independently done quite a number of cases across all over India. I recently joined Arihant Hospital some 6 months back. My main specialization is mainly concerned about aortic surgeries. Aorta, as you know, is the main pipe, or the, you can say, the tunnel from which the blood pumps out from the heart and goes to the entire body. So we mainly deal with surgeries for the conditions which arise from the diseases which occur to the aorta, what we call as something like aortic aneurysms or aortic dissections, such kind of operations. These are quite complex conditions.
Doctor, can you simplify what is aorta for an average patient who would like to understand this?
Aorta is basically, it's like a main pipe, as you know, which from where the blood from the heart, when it pumps, the blood goes into the entire body from this aorta, and this is the only pathway from which the blood can go to the rest of the body from the heart. So if anything happens to this aorta, then the patient will have quite fatal problems. In the sense, definitely patient is going to lose his life. So most commonly the conditions which happen with the aorta is that one is called as aortic dilatation or aortic aneurysm, in which the pipe becomes quite big enough, and that can cause problems. The other thing is what is called as aortic dissection, wherein this pipe can fall apart, it can rupture. So in either of these conditions, the patient will die immediately. So for dealing with such kind of operations, we need a very complicated procedure, and we need a huge team for that. Fortunately, at Arihant Hospital, we have been dealing with such kind of conditions now pretty often. As you earlier said, that the hospital is growing with every day. So people are recognizing that ours is a tertiary heart care center in this region, and we are getting such kind of complicated patients from all over the region, from South Maharashtra, Goa, as well as from North Karnataka. And we often get such patients, and we are operating on these patients quite often now. We are very much sure that in recent future also, our scope for doing these surgeries is going to increase further.
I also wanted to ask Dr. Nikhil the same question. Like, what is the rate of success in this? Like, is it higher than the earlier types of procedures? Like, what is the rate of success rate in these surgeries? Be it minimal invasive or aorta kind of surgery that you are saying of?
As Dr. Nikhil said about minimal access surgeries, our results of this center are in par with any other center in the rest of the world. We can rest assured that. There is no doubt about it. As far as the IoT surgeries are concerned, this disease per se is very much complicated, as I told you earlier. So the success rate also depends on the same situation. But again, if you compare with the centers which are doing such surgeries at a very routine basis, I'm talking of centers which are in very big cities, in metros or in international centers and all, our results are again in par with those same centers. That's how I can put it on.
आजकाल जाणट्यांच्या बाबतीत सुद्धा जे हार्ट एलिमेंट्स आसातूच, तरणाट्यांचेय आता जायतो म्हणजे प्रमाण वाडलेलें आसा, चड करून गोंया भितर. पूण आतां आनी एक व्हडली गजाल म्हळ्यार आतां हांवें हॉस्पिटलांत भोंवडी मारतकूच म्हाका एक 5-6 भुरगे दिसले जांकां काळजाचें दुयेंस आसा. दे हॅव गॉट अ हार्ट एलिमेंट. सो in this regard, like, you know, this is a latest unfortunate development, we would say. But what we need to have that kind of surgeons, that kind of doctors. So we have with us at Arihant Hospital Dr. Govind, who is specializing for the children heart specialist. अशें आमी म्हणूं येता तांकां. So Dr. Govind will tell us, like, what are the advancements in this field and why there is a need, and what is the type of cases that are there in this particular ailment. Dr. Govind.
Hi, my name is Dr. Govind. I am a pediatric cardiologist. I specialize in 3 subspecialties. One is pediatric cardiology, where there are 2 types of modalities. When we talk about heart disease in children, they have 2 types of problems. One is which is congenital, that is which they have had since birth, and then is second type of problem which they have acquired. So we deal with both kinds of children, that is ones which they get after birth and ones which they get at birth. So I specialize in congenital heart disease. We close holes, that is there are 3 types of holes mainly: AST, VST, PDA. We close all these holes whenever they are to be closed at the appropriate time. And then we also open vessels which are blocked. Like there are 2 vessels which come out of the heart, like Sir said, aorta and pulmonary artery. So if they are blocked, we put a balloon and open. They are found to be blocked in children also. So we open them, we stent. There are other blockages of the aorta, we treat them also. The problems in children start from the mother, when they are inside the mother. So we diagnose heart problems when they are in the mother. It is called as fetal cardiology. That is the second branch I subspecialize in. It is called as fetal cardiology. We diagnose when they are within the mother, and then we make sure that the treatment goes immediately after birth. So that is the advantage of knowing what heart problem is. And also, for many small problems, people take tension about what needs to be done for the pregnancy, whether they should go ahead or not go ahead. So at these times is our role, when we need to tell them that this heart problem has treatment, or this heart problem needs treatment in the first place or no, whether it is significant or no. All these things we deal in fetal cardiology. And then once the baby is born, whatever problem it has, until it grows up, we take care of those problems.
One general question, like, earlier only the elders who used to have these heart ailments and all that. Later on, it is the youth that is having. Earlier, now these days, the fathers are bringing their sons for the heart surgeries in the hospitals. But now it is perhaps become a common ailment among the children. I mean, especially the newborn and the infants also. Like, what is the reason you feel, doctor? And are there any preventive measures that can be initiated to prevent this kind of ailments?
With respect to whether the incidence has increased or no, I would say that the incidence has remained almost same. The detection has increased. Earlier, there were same heart problems in children, but they would die without being identified. Now, with advancements in technology, we find out children with heart problems and treat them. Since the rate of pickup has increased, we are feeling that the heart disease has increased in children. But if you look at overall and compare with other countries and our data, it has remained the same. Children with heart problems has been strict. Now with your second question, whether we can prevent heart disease. Usually the children in heart disease in children, it is usually genetic in origin. There is no one particular gene which is reason. So usually it is genetic plus environmental. It is hard to prevent a congenital heart disease.
At Arihant Hospital, we have a patient, Theodore Gomez, who has come all the way from South Goa. Theodore Baba म्हाका सांगतले की हांगा ह्या हॉस्पिटला भितर एक अशें कितें खाशेलें आसा की गोंयांतल्यान ते हांगा येतात आनी तांणी हांगा कित्याक बसत आयल्यात ते आमकां सांगतले. थियोदोर बाब.
हांव गोंयां येवपाक हिंगा बेलगांव येवपाक आर्यन हॉस्पिटलांत येवपाक म्हाका 2-3 दोतोरांनी पयलीं हांव चॅक केलां आनी ताणें म्हाका रिकमेंड केलां दोतोर डिक्सिटा बोले तुगे बायपास सर्जरी करपाक. ताका लागून हांव आयज आर्यन हॉस्पिटलांत येयलां आनी मुगे आंटी पयलीं ताणें ऑपरेशन केल्लें आनी मुगे जायत जावं बरें मुगे फ्रेंड आसले तांणी म्हाका रिकमेंड केलां दोतोर डिक्सिटा बोले वोसान तुगे ऑपरेशन कर म्हण. त्या खातीर हांव गोंयांच्यान हांगा आयलां.
दोतोरान कितें भरोसो दिला की हें बरें जातलें, बऱ्याक पडटलें म्हणून. आनी तुमी आनी कोणाशें आयकलां की हांगा खुबशे अशे बऱ्याक जायते पेशंट येतात आनी बरे जातात म्हणून तुमी आयकलां?
आनी मुगे जायत फ्रेंडांनी म्हाका सांगिलां तांगे पायक बी केलां बरे भाशेन बरें सक्सेसफूल ऑपरेशन केलें म्हण. तें सगलें तेंगे आयकोन हांवूय हांगा येयलां ताज्या हातींतल्यान करपाक. आनी जायत पाटी अशें म्हणलो आसता की दोतोरागे हातगूण बरो आसपा जाय म्हण. ताका लागून तेगे हातगूण बरो म्हण हांव ताजे बोले हें ऑपरेशन करपाक आयलां गोंयांतल्यान हांगा बेलगांव.
देव बरें करूं थियोदोर बाब. I'm with Sushim Shinde, whose father has been admitted in this hospital, that is Arihant Hospital, and Dr. M.D. Dixit is treating his father. So Sushim will tell us about his father, what is the ailment his father is facing, and what are the facilities the hospital offers, and he'll tell about overall experience. Yeah, Sushim, please tell me what brought you all the way from Gulbarga.
Yes,
about
sir.
About 400 kilometers.
400 kilometers.
Yeah. So he's come now from about 400 kilometers to Arihant Hospital here. He has brought his father because of the confidence in Dr. Dixit
Dr.
and
Dixit.
the facilities
Yes, sir.
available.
Yes,
Can you
sir.
tell something about it?
Yes, we know Dr. Dixit from past 25 years because earlier my uncle, he got operated under him. So he was also a heart patient. So sir has operated and he's still healthy today also. So he is at the age of 73 now. So currently, recently my dad got diagnosed with blockage
heart blockage, and my dad is 71 years old. So we didn't have any option to go for who is the best cardiologist. So we had an family gathering, and we thought of visiting Dr. Dixit sir here. So once we visited here, he has thoroughly explained everything. He has taken all the tests and everything. Then he told what are the plus and minus negative points. And today morning, my father got operated. That is CABG. He has gone under CABG, and he is in ICU now currently. By evening, he will be shifted to the wards. So here in Arihant Hospital, the facilities are above the par, you can say, because all the rooms you can see the staff cleaning 3 to 4 times a day. They come to the rooms. We have taken a deluxe room here, and the area is more well lit, and light and ventilation is very good, which is good for a patient. Yes, and even the facilities such as the cleanliness of the room and the everything like food and everything, it is good here. You can say.
What will you tell about Dr. Dixit's personal approach to the patient and the rapport that he has been establishing over the years?
So looking at his schedule, because I know from past a week or something, like we are visiting here, and he's very down to earth person, very like friendly with the patients. He will tell you everything, what is the like the procedure that they are going to do, and what are the different options and everything, and what are the future things you can get in life. That those all things will be told by him. So he's very like very friendly to the patients. That is what I'd like to say.
How about the other facilities like the follow-up, the backup staff and other facilities that the hospital offers? Many times, the attendants may not be available in time and all this. What do you feel about it?
Here in the Arihant Hospital, everything is like well sorted, like an orchestra here. All the nurses, the duty nurses, staff nurses are available 24/7 at the nurse station here, and we did not face any problem with anything like that. And anytime at midnight also, if we go and approach them, they are openly helping us with all the facilities and whatever requirements the patient is required.
Did he undergo any advanced surgery or procedure that has been introduced recently, that is minimal invasive surgery and other procedures?
No, we went with the CABG only. It's a very conventional kind of like a bypass surgery. So we thought of minimal surgery, but we opted for a CABG here. So that is what.
So definitely Arihant Hospital has been offering the ultimate solution for all the heart ailments. People from far and wide are reaching this hospital to resolve their health issues, and there is a guarantee called Dr. M.D. Dixit, who has been more than a doctor. He has been treating the patients like their friends and all that, and that's the confidence that the patients have, and more than that, the relatives have established over the years over Dr. M.D. Dixit.